Start off, as we usually do, with a skit in the opening session that will address and make clear some of the deficiencies we have in one of our most challenging workflows. But it's a workflow and a particular domain in radiology that actually for many years has addressed a lot of accountability and a lot of external requirements and regulations, and that is mammography and breast imaging. When you look at breast imaging, their workflow is highly complex, and they have been for many years because of MQSA and other external regulations and requirements have required to document what they do with respect to yield, with respect to their biopsy results, with respect to reporting of critical results. Now, as many people who do mammography recognize, we do this and they do it well. They provide great service. It should be even though we recognize that mammography should be a model for the rest of radiology with respect to the service they provide, the accountability, the evidence-based practice, the way they do it now is highly inefficient. A lot of people in the back room, a lot of inefficiency, and it's really a lost leader. It loses money for most radiology departments. The real challenge is now, because of healthcare reform, we are now going to be required to do exactly what mammography has done for many, many years, and yet for the whole department, and even more than what they're doing with respect to reporting and regulation, to demonstrate meaningful use, to demonstrate accountability, evidence-based radiology. If we use the same methodologies they do in mammography, we're not going to survive economically. And so the real challenge that we're going to try to illustrate in this opening session, as well as the rest of the meeting thematically, is how can we leverage IT and informatics to achieve the high level of service and quality and accountability that we have in mammography, but to do it for the rest of imaging, radiology, cardiology, everyone who deals with imaging workflow, to do it in a way that doesn't break the bank, that uses optimal interoperability and integration, that leverages improved workflow and leveraging IT solutions to achieve this in a way that's scalable and sustainable, but still maintain the high level of accountability that we have in our mammography colleagues. So the skit is going to demonstrate what mammography does today as a workflow. It's a good example of how what we're supposed to. We're going to start with a skit describing what mammography workflow is today. The point is to show and demonstrate that mammography is our model for the future of all of radiology and imaging, and how current systems are not sustainable. And then what we're going to do is we're going to show what could be done if we maximally leverage IT and informatics to achieve the same level of accountability that we have in mammography, but do it in a way that is sustainable, cost-effective, and actually goes beyond the accountability that we do in mammography. So it should be fun. We're going to continue this theme throughout the meeting. Keith Dreyer is going to be giving the Sam Dwyer lecture, and he will be explicitly addressing the concept of meaningful use in healthcare reform and how that will impact imaging informatics and radiology and cardiology and other imaging specialties in medicine, and what we must do and how we must use informatics and IT to address those issues, to manage the expectations and requirements for reform. Throughout the meeting, this theme of how to manage and optimize healthcare reform through informatics will continue throughout the learning tracks.